Nearly 2 years since COVID-19, I can't believe I'm saying this, nearly 2 years since COVID-19 hit our shores. The pandemic is not backing down. South Africa is once again recording a spike in new cases and hospital admissions. The Gauteng province has the most number of active cases, but just how are some of the province's big hospitals coping? eNCA reporter Manqoba Mchunu is joining us now to unpack the situation. Manqoba, just tell us first of all which hospital or clinic you're visiting at the moment and if there are any concerns in terms of bed availability at the moment.
Well, Masicho, we are in a different location. We are at the Orlando West Methodist Church, of course, which is one of the pop-up sites that have been set up this weekend. You recall, Masicho, that on Friday, the Health Minister, Joe Phaahla, declared the Vuma Week to try and ramp up the number of people that will be receiving the COVID-19 jab. Of course, it is quite a concern at this particular point, given that we are in the midst of a fourth wave of infections. And from some of the utterances and some of the speeches that we heard from the Gauteng provincial government on Friday, they are saying that Gauteng is likely to see the fourth wave in the next 2 weeks. But of course, the concern, Maseko, is around the number of people that have been vaccinated so far. We do know that just over 8 million adults here in Gauteng have still not been vaccinated, which is a major concern. And so this is just one of the ways in which government and some of the stakeholders, we are here. We know that this is a partnership between the South African Council of Churches, this particular church, as well as Solidarity Fund, to try and ramp up those vaccinations. But I'm going to speak now to Bishop White RAKUBA on this particular vaccination site and why, as a church, they have opted to preach the gospel of vaccination. We do know that the sermon this morning was also centered around calling on people and congregants, more specifically here, to get vaccinated. Thank you for your time, Bishop. Let's start here. Why do you feel the need, as the church, to reach out perhaps to the community? We do know that there's still quite a huge concern when it comes to vaccinations in this particular province. Why did you reach out as a church to congregants to get vaccinated?
As a church, we have a community, and many people are a part of our life. And the COVID-19 has really affected the churches over the past few months. So we feel that is a good thing that we should speak to the people, encourage them to vaccinate. As now we are seeing that the figures are going high. Yeah, and then if we don't do that, then we may have serious problems.
But you're also speaking as the chairperson of the South African Council of Churches here in Gauteng. Is this the call that the SACC is making across the province and across the country?
Yes, across the country. This weekend we said we have to go out and preach the gospel of vaccination, that people must come out and then do the vaccination. Yeah.
And just looking at Bishop, I mean, we have seen previously how this has impacted the hard lockdowns that we've seen impacting the church as well. You know, what sort of message are you sending in terms of congregants, the need for them to get vaccinated in order to try and perhaps avoid another hard lockdown? Is this something that you're also saying to some of the congregants?
Yes. One, the lockdowns have really broken our fellowship, our coming together as churches. And we are not only talking about maybe monies and everything. We are talking about that important communion of being a church together. That has done that. Secondly, a lot of our members have died. And we had to really struggle to go and bury them because there were some restrictions. And we feel we need to really wake up and make sure that we encourage people as much as possible to vaccinate.
But of course, the biggest challenge, Bishop, is the fact that there are many who are still hesitant to this vaccine. There are many conspiracy theories around this vaccine and overall concerns over the safety. What would you say to those who are still hesitant about getting this?
We are saying to the people, those stories are not real. I like what the preacher said this morning, that people should be ready to be taught and be educated rather than just to listen to other theories.
Okay, thank you, Bishop. I want to move on quickly, Masigo, to the Solidarity Fund. And joining me now is EDMOND MATLADI. And EDMOND, you are one of the community mobilizers here in this particular project or this particular site that you are on here. What is your message really to community around Soweto, and why is it so important to vaccinate?
Thank you very much. First and of all, the message as a community mobilizer that we are spreading together with the Department of Health is that, one, vaccination is safe, and we provide factual information to the people in our community so that they don't listen to the rumors, but they actually have information that is factual, information that is relatable, that they can always refer to, that makes sure that at least they know, just like the Bishop said, that if you are able to be teachable and you are able to learn from the information that we as the community mobilizers are giving you, then you will be able to know that there is nothing to fear. The vaccine is the only hope that we have as a country to make sure that we fight this epidemic.
And what has been the response so far? I can see that there are some congregants that have heeded this call to vaccinate this morning, but are you seeing a bigger response in terms of the numbers of people that are coming?
Look, honestly speaking, right, this is an effort that we as the Solidarity Fund, the Department of Health, together with the South African Council of Churches, Gauteng, have embarked on to come together and make sure that, number one, we make the community aware that vaccination is important. Vaccines are safe. And from what we have seen so far, the community mobilizers going around in the vicinity of the church, talking to the community members, we are seeing people responding, because in the vaccination room, we are having people now who have heeded the call and are vaccinating. So you see, if we keep doing this, instead of the people having to come to us, but we come to the people, then we will be able to make sure that the lag that we are experiencing right now, we are able to pick up the numbers.
And are you targeting specific groups of people? We do know, for example, that this particular Omicron variant that has hit our shores is currently problematic when it comes to younger people. Is there any particular groups of people that you are looking to get to come and vaccinate here?
Look, what we have done is we have opened it up to every single one, because every single person is in danger, of the virus itself. So yes, right now here, our community mobilizers have communicated a lot with the young people, and we have seen a nice turnout of young people coming to vaccinate today, right here at the church. But to be honest with you, that is why we always say to people out there that you must take advantage of opportunities like this one, where a pop-up site is at your church in your neighborhood. Take advantage of opportunities such as the Vuma vaccination week, where you are able to go and get vaccinated at the malls, at the major transport hubs, and recreational facilities. So if people can be able to do that, then I believe that we will be able to lessen the impact of this fourth wave.
Okay, thank you very much. So that's EDMOND MATLADI, who speaks on behalf of Solidarity. Well, we do know, Masigo, that there are over 250 vaccination sites, pop-up vaccination sites that have been opened this weekend and going to the 10th as part of these efforts to ramp up vaccination in the province and throughout the country. And the target really, Masigo, is to reach over 1 million people that hopefully will be vaccinated as part of this drive. We do know that the previous two drives that were held on the 1st to the 3rd of October, as well as the 12th to the 14th of November, those saw just over 650,000 people being vaccinated. So there is this effort by government to try and ramp up the vaccinations ahead of the festive season. Of course, that is a time when most people will be out and many people may be socializing. So trying to minimize that risk ahead of that festive period.